The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Time to baby your baby. We have Dr. Rick Gardner here from Intermountain Bear River Clinic to talk a little bit about medication while pregnant. And we were just talking, and he said that before you're pregnant, you need to be careful about medications too.
Right, Mary. So, most of the time it takes about 2 to 3 weeks before you figure out that you're pregnant.
Right.
And that's really, really important times that your baby's growing, developing. And so it's really important that you know what medicines you should be on and what you should not be on before you even get pregnant. So getting into your doctor, talking about those medications, what you're on, what you're taking, and making sure that you're on the right place right off is good for your starting your pregnancy.
What are the no-nos?
So there's some blood pressure medicines in particular that we want to make sure that you're not on. Even things like ibuprofen, taking that regularly can sometimes cause some issues early on in pregnancy. And so, and then the main thing that we want you on is a multivitamin with plenty of folic acid. That folic acid is really, really important for baby's brain growth. And so we want to make sure that you have adequate folic acid on board even before you get pregnant, so baby can start out right.
Well, and I think more than half of all pregnancies are unplanned.
Right.
So
exactly.
If you're of childbearing age, you should probably be taking that prenatal vitamin.
You better believe it. I tell people you need to be either on birth control or you need to be on a prenatal vitamin.
Okay. And what are some things that people have questions about, like supplements maybe?
Yeah, so as far as certain supplements, a lot of times people think that just because it's natural that it's safe, and there are a lot of supplements out there that can actually cause harm to your baby. And so in general, sometimes they're not well studied, but the ones that are studied, we can kind of guide you as physicians to kind of let you know what to take, what not to take, things like that.
Okay, and Baby Your Baby is all about getting a good relationship with your doctor.
Right.
And getting those prenatal visits. And anytime you have a question about a medication, call your doctor.
Right. And I agree. I think that again, before you even get pregnant would be the best time to establish that relationship, to kind of talk with your doctor, to get comfortable with your doctor, and then that way you have a great plan going forth through your pregnancy, and then also continuing on that relationship after you deliver.
Okay, better chance of having a healthy baby. Thank you so much, Dr. Gardner.
You're very welcome.
Ron?